So you're welcome here. In this video, I'll be talking about what you should keep in mind as you participate in this intervention program. First of all, this program is scientific in approach, and the program is not a quick fix. We're going to be dealing with diabetes and hypertension in this program. It's very relevant to obesity, overweight as well. So we're going to be dealing with that alongside. And you should keep in mind that this problem had occurred over a long period of time. In fact, most people with hypertension and type 2 diabetes, it's a thing that has been in the process for a long time before it eventually shows up. So you should keep in mind that it's not a quick fix. It's not a problem you're going to solve in 2 weeks, because this is a problem that had come over time. So you must be very patient. And if you do what you think it's correct, contrary to what you are directed to do, you should not be surprised if you do not get results. So I believe if you had come on this program, it's because you have seen a need for you to learn, and it's because you've seen a need for you to be helped. Therefore, I think it would be the most reasonable thing to comply, not to do what you think you want and be expecting to get results. That's going to be counterproductive. So please comply fully. Again, you will need to make dietary sacrifice where it's not difficult, and it's for your health. So within this period, you're going to be making dietary sacrifice, but it's not going to be difficult. It's not going to be challenging. Just hear whatever concern you might have, and it will be addressed. So you will record improvement within 2 weeks of following this program, but it doesn't stop here. So what you should understand is, you definitely, if you follow as it is stated, you record improvement. Most of the people that have been on this program record remarkable improvement within 2 weeks of following diligently the diet, the exercise, and every other thing. So you will do that. I'm not at all. I will not be surprised if that happens. But I'll be honest with you that I've seen people that did remarkably well within 2 weeks. They thought they've been able to reverse diabetes or reverse hypertension. Then they began to do whatever they will, and they get back exactly to where they started from. So we are beginning to deal with a problem within these 2 weeks program, but that's not where it ends, and you should not think that that's where it ends. Take this program as a taster program. It's just a fragment of the entire program. So this program is designed this way so that you could see that we can truly help you, and you'll be ready to make more investments. So don't take it as the overall program, but just take it as a taster program. And imagine if you have a pot of soup and you just taste part of it and you think you have it all. You don't. You only taste a little. So watch our video, participate in discussions. Please send general questions to the group and not to me personally, not to any of the admin, but please send general questions to the group. If you have access to personal service, then you can use that for personal service, and be ready to make more investment, like I've said. And by saying more investment, be ready to spend more money for a complete program and for services that will enable you to deal with the root of diabetes and hypertension and reverse it truly. Even if within these 2 weeks it happens that there is a need for you to stop medication, don't think at that you have deal with the problem completely and you have gone. So be ready to make more investments. We are ready to work with you to recover your health fully, and be patient. It's recommended that you spend at least 3 months on this program. Most people that comes to this program are able to achieve the target within 3 months. So that's the minimum recommended time. And what are we going to be doing within these 2 weeks? We want to push out the death. And the deaths there are two main deaths, and that's sugar and whatsoever is causing inflammation within your system. So those are the two main deaths. Now, don't think about talking about sugar. Don't think about that in respect to diabetes. So you are drowned, but you are not drowned in water this time. What you are drowned hits the cells of your body. If you have diabetes, is drowned in sugar. And also, if you have hypertension, you discover that most people who have diabetes end up having hypertension, and most people who have hypertension end up having diabetes. Why? What again do you think is common with both? Most of the times is obesity, overweight, and the rest. It's because these people are drowned in sugar primarily, especially diabetes, and extremely relevant to hypertension as well. And more so in hypertension, we are dealing with the problem of inflammation. Inflammation simply means swelling. So imagine if different apparatus that deals with blood within your body, that deals with your blood pressure, undergoes inflammation and they are swollen. So all of this problem happens. But you don't need to panic, and that's exactly why you're on this program. We're going to deal with all these problems sequentially, and by God's grace, we'll be able to achieve it. Now, a big picture is to get you off medication. And by getting you off medication, what I mean by that is that when you follow our program, you engage with our services, our big picture is to get you off medication. But that doesn't mean that when you come on this program, you should go and stop your medication. Neither does it mean that I'm going to stop your medication by the time you send me and ask me the very question, should I stop this medication or not? As a matter of fact, these 2 weeks, you continue with your medication. And after 2 weeks, it doesn't mean you're going to stop medications abruptly. Like I said, this problem developed over time. But by yourself, you will see a significant improvement. What do I mean by that? Maybe you have been struggling hard to, for instance, let's say you've been having a blood sugar of 150, let's say between 150 to 200. And by you following this program, you discover that your blood pressure had come down to 100. Maybe you are still on your medication. And you discover that following diligently, you can see an improvement of such significantly. Is that not an improvement? So that's a good improvement. And you should know that that's what we are focusing on. Now, if you have not been able to achieve that, but by following this program, you're able to achieve that, is that not a signal that by the time you comply more, you are going to do much more better? So that's the way I want you to think and to comply, because it's going to cost you less of your time, less of your resources, less of your emotion if you do that. So that's the big picture. That is not what we are encouraging you to hurry out to go and do. You must follow sequentially. It's good to be off medication, but if medication will keep you alive, it's better to be on that medication than to say you don't want medication and you foolishly cut it off and it ends up affecting organs of your body and you end up with complications. So we have to balance this knowledge. We are not in a hurry. We are trying to see as it progresses. Like I said, within 3 months, many people on our program are off medication. I've seen examples of those who are not off medication within 3 months, but they significantly improved. They themselves are very happy. Probably their medications are lowered, it works, it becomes lower, and so many other significant changes that happens. And that's how I want you to see it. And I remember I monitored one person personally that it took about 18 months. Within 18 months, it did not require any medication again. So that's what we are talking about. We're not talking about, our approach is scientific in short, and that's how you should see it. So that's the big picture. And then we want you to be able to keep your fasting blood sugar less than 100 milligram per dl. That corresponds to 5 millimole per liter. Your 2 hours to be postponed post food less than 140 milligram per liter, and that corresponds to 7.8 millimole per liter, 140 milligram per dl, I mean. Then your hemoglobin A1C, and we're going to do this test 3 months after you've been on the program. and we want it to be between 4 to 5.6%. So you should take note. Other big pictures to keep your blood pressure within normal parameter. We want it to be lower than 140 for the one that is up. That's what we call systolic. And the one that is down, we call it diastolic. We want that one not to be more than 80. That's our big picture, so that it doesn't cross 140 and it should be below 140. But much more, we want it to be within 120 and lower, and 80 and lower, not lower than 90 for the one up and not lower than 60 for the one down. So we want to keep blood cholesterol within normal range. That's going to take some time for the blood cholesterol. It's not what we are thinking about within these 2 weeks. And again, to prevent and deal with complications, to prevent chronic diseases, those are our other goals. And to help you be in healthy weight. Some people, you might think you're in healthy weight, but your abdomen, excessive abdominal fat, it's common, very common amongst us. So that's what we should work on, dealing with that as well, and being healthy weights to resolve the problem of food addiction, and also to help you get significantly better. So that's our goal. That's our goal, and that's a big picture. And I believe that, but if you comply and if you are able to invest in your health, you're going to achieve all of this. Thank you, and I'll see you in the next video.